Allen podcast. I'm excited to welcome to the world, Doc Allen Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil, and you?
Fantastic. Today's topic is the bird flu. What is the bird flu?
Well, it's a viral infection that birds can get. Chickens, ducks, geese, cows, other mammals can sometimes spread from mammals to humans. And this is the H5 subtype. It is a variety of influenza A, so it is common.
Okay. What are the common symptoms of bird flu?
Well, it would be severe respiratory symptoms and almost always pink eye, but there are a lot of people who have bird flu and who don't ever even know they've had it.
Who's at the greatest risk to become sick with bird flu?
Well, again, it's the people who take care of chickens like I do, because my chickens are isolated, ducks, cattle, and of course, you can also get it by breathing in the dust of the critters who have it.
Can bird flu spread from person to person?
Very seldom. It's really, I don't think there are any instances in this country of having bird flu spread from one person to another. However, there have been, I think, about 60 some documented cases, and they've come from exposure to these birds and cattle.
Is bird flu the most common influenza in humans?
Yes, influenza A, and that is influenza A is very common in humans. Bird flu is the particular variety of influenza A. The bird flu variety is very, very rare in people.
How does bird flu spread?
Well, again, it spreads through infected saliva, respiratory droplets, and urine, feces, body fluids. So you can get this by improperly cooked poultry, eggs, or drinking milk which is not pasteurized.
Is bird flu contagious?
Well, not from person to person, at least not yet. But of course, the issue is, are we going to have a mutation which will cause it to spread from person to person? At this time, we don't have that.
What are the complications of bird flu?
Well, they again can be respiratory distress, and you can get encephalitis and meningitis, which would be serious.
How's bird flu diagnosed?
Well, there is a swab, but the thing about it is your doctor will first run the influenza A swab, but you have to tell your doctor that you think you might have been exposed to bird flu, and then the doctor will order a special influenza A test. But the swab comes from your nose or mouth.
What is the treatment for bird flu?
Well, there isn't any treatment right now. It would be supportive. You know, if you were having vomiting, then you'd get an IV. If you're having respiratory distress, you probably get some antivirals.
When should I go to the ER?
Well, if you have difficulty breathing, if you have a fever that's over 103 degrees, confusion, fatigue, difficulty waking up, severe headaches, or a stiff neck.
Best place to go is worlddocallen.com and pick up Pregnancy Your Way, available on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast, guys. Take care.